Okay, hi everybody. I was really nervous about this. Everybody's saying, well, why are you nervous? You've done so good so far and you haven't been one bit nervous, but I've just been sitting in front of one interviewer or on the radio where you can't see anybody, so it's been fine. So if I'm a bit nervous and my voice catches today, it's because I'm really nervous. If I start going too fast, just somebody say, Susan, I'll give you that job to slow down. I'm delighted to be here today. Myself and Stephen were actually so delighted to be asked to come here today. I don't know where, Joe, you're sitting there. There was a lot of controversy about this a couple of weeks back, and I just didn't get involved for lots of reasons. But I was never not going to come. To me, it was too important. The reason myself and Stephen are doing this is to keep the cervical check story in the media, in the minds of the public, because it's so important, not just for us. I mean, a lot of people that are here today are testament to that. This is important because it affects every woman in Ireland and every family in Ireland. Every woman has to have a smear. So that's why we're trying to keep this story alive, because we want to get answers for you. And I'm doing this because I have a daughter who's coming up. She's nearly 13. She's having periods already. So, for me, it's important. That's the bottom line, that I want to have a health system that I can trust for her. So I'm going to start today with a quote from Mary Harney, who was Minister for Health at the time of the outsourcing of the smears. But this quote comes from another scandal. So it was following the report from the Commission on Patient Safety and Quality Assurance, which was set up following the Lourdes Hospital scandal, the Dr. Neary scandal, I suppose, as most people know it. Her statement is as relevant today as it was 10 years ago, and that's the reason I'm kind of using this quote, because nothing has changed. This is the point. This is 10 years ago, and we're still in the same situation. We live in an imperfect world. As human beings, we all make mistakes, and no system is perfect. However, all of us working in the delivery of healthcare owe it to our patients and to ourselves to do all that we can to minimise errors and maximise quality. The best way to do this is to accept and describe honestly where and how mistakes and failures have occurred in order to learn and improve. A blame-free reporting and management culture is in the best interests of patients and those delivering services. I think that statement, made 10 years ago, really, nothing has changed. And that's all that most of us want is, and Margaret and Stephen are going to talk about this as well, is just, somebody to accept that a mistake was made and to describe honestly what happened. This isn't all about litigation and money. Most patients, if you ask them, just want to know what happened and where it went wrong. And I think if there was more of an openness, we wouldn't be in the situation we are today with all of these scandals. The single biggest obstacle to health reform in Ireland today is the lack of any functioning legal accountability mechanisms for healthcare professionals, particularly management. The doctors have the Irish Medical Council and the nurses have their own council, but for management in particular, as we have seen with the cervical check scandal, 2 people have stepped down, but there is no accountability. Gráinne Flanley went back to her position as a gynecologist, and Tony O'Brien, was due to retire anyway. That's not accountability in my book. You are going to hear from Stephen, Margaret and I today. We have, all 3 of us, experienced firsthand the failings of our health service. While our stories are very different, we are all united in one thing, and that is our demand for accountability. So when I was getting ready today for today's session, I knew that I wanted to frame my story with accountability front and centre. To me, that's what this is all about. When I was at the Public Accounts Committee a couple of months ago, people took up on that, but that is basically, why I'm here. I don't want revenge. I'm not after, getting people fired. That's not what I'm about. I want accountability because I don't want this to happen again. I don't want another scandal, no more than anybody else in this room. So I broke my story down under 3 headings, all of which come under the accountability umbrella: patient safety and quality, open disclosure, and patient advocacy. And they are 3 things that really, epitomise accountability in my book. My story broke on the 25th of April when I settled my case for $2.5 million, which was a record sum at the time, against the US laboratory CPL, with no admission of liability on their part. My case against the HSE, who I had also sued, was struck out. However, what I have found out since my case settled through the Scally inquiry, because one of the terms of reference of the Scally inquiry is actually me and my case. So what I have found out from Dr. Scally is that the lab would not settle my case until the State Claims Agency paid a contribution. The amount of the contribution was only 25,000, but the implication to me means a hell of a lot more. Okay, so the State Claims Agency were forced to accept some of the responsibility for my settlement. This is important to me, since like Stephen and Margaret, my quest for answers is about much more than money. It is about accountability. Accountability in my own particular case started with cervical check and my own gynecologist, who did not afford me the option, or who did not afford me open disclosure by not disclosing the results of my audit, and who did not consider my audit result to be a patient safety incident. Remember that in my case, my 2011 smear that was audited went from having no abnormalities whatsoever, and I had never had an abnormal smear up to that point, to having query squamous cell carcinoma. So I went from having no presence of either precancerous cells or lesions to having full-blown invasive cancer on the review of my smear. Neither cervical check or my gynecologist considered my entitlement to know this information about my body. Mandatory open disclosure means the required disclosure of any serious patient safety incident, that is, any unintended or unanticipated injury or harm to a service user that occurred during the provision of a health service. And I was not afforded that information. I found out through discovery in my case, through my solicitor, that correspondence took place over a 15-month period between July 2016, when Cervical Check started the process of communicating the outcomes of clinical cancer audits to clinicians for onward communication to patients. Again, onward communication if they saw it fit to communicate this, because remember, we were in a period of voluntary open disclosure at this time. So between July 2016 and September 2017, when my gynecologist decided to actually go against the wishes of the then director of Cervical Check and tell me about the audit. The tone and content of these emails was shocking, both to me and my legal team, because of the nature of the length of the correspondence, which went on over 15 months, and also, they were talking about holidays, in amongst all of these questions about whether or not they were going to tell me. Sorry now. And I think this kind of encapsulates it quite well. Annie West, who was a cartoonist from Sligo, drew this cartoon. She told me, because I rang her, in a rage when she was listening to me on the radio tell my story, and she, basically she said rage cartoons work the best, so I just think this encapsulates it very well. There's me in the middle, tell me what, and then a circle of, doctors and whoever you want to think, legal people, not my job, you tell her. And this is basically what went on over 15 months. The correspondence between Cervical Check and my gynecologist revealed that the director of Cervical Check only considered 3 of the 10 cases that were communicated to my gynecologist to be worthy of being communicated to patients. Mine was not one of those 3 cases. Furthermore, if a woman had died, the advice was to simply file the audit results in the deceased woman's file, which is what happened in Stephen's wife's case, and not to communicate this information to the next of kin. For 15 months, I was kept in the dark. Worse, my cancer grew back, growing inside me, but I would not find this out until November 2017. I firmly believe that if I had been informed about the audit in July 2016 and told that my cancer diagnosis was 4 years older than what I knew it to be, I would have insisted on a scan and may have been in a better position for treatment options than what I was offered when I did find out it was back. I will never know, because I wasn't told. This inalienable right to knowledge of my own health status was taken away from me. As it was, it would be another 15 months before I was told about the audit, and 17 months before I received results of a scan revealing that my cancer was back, and this time it was terminal. I am satisfied that my gynecologist eventually decided to do the right thing and to communicate the results of the audit to all of his affected patients. So he communicated the results to all 10 of his patients. He was told only to reveal them to 3, and I was not one of those. If he had not communicated this information to me, I believe that we would not know about the failures of our cervical screening programme. We would not know that 18 women have died as a result of these failures, and we would not know that 203 other women, and possibly more, were misdiagnosed, because there will be more. There are 1,800 other smears that have not been audited. They weren't subject to the internal audit that had taken place, and these are now going to be the subject of an independent review by the Royal College of Obstetricians and Gynecologists. So, the number that we have at the moment is based on an audit of 1,482 slides. What's left to analyse is 1,800. So, you can do the maths. We're going to see another 100, if not 200 other women who were probably misdiagnosed as well. Examples of serious patient safety incidents, according to the legislation, include patient death and serious errors that emerge in screening programmes. Yet, in a briefing note to the Minister of Health just before my court case, the National Screening Service and the head of the National Cancer Programme, Dr. Jerome Coffey, did not consider my case to be a patient safety incident, but rather a reflection of the known limitations of screening. So, when the Minister was told about my case going to court, this is what he was told, that this wasn't a patient safety incident, and, my misdiagnosis was due to the limitations of screening, and it was a false negative. That's what he was told. Dr. Coffey has since expressed regret about advising Minister Harris that the circumstances surrounding my case did not amount to a patient safety incident. This is too little too late in my book. Unfortunately, here in Ireland, we are becoming all too familiar, and I wonder at times if actually we are even becoming inured to health scandals because we've had so many. The cervical check scandal has become just another health scandal to add to the list of public health scandals, from the hepatitis C scandal to the Lourdes Hospital scandal to the Portlaoise baby death scandal, and more and more and more. I could keep going. Minister after minister expressed their outrage and hope that the scandal will be a catalyst for change. We've heard lots of statements from ministers and politicians, and they all express the same thing. And when I was researching the other scandals, what was interesting was a lot of the statements they were making, it's almost like they have this template that they read from, which sounds terrible, but they use the same words over and over again, yet nothing changes. We have seen the establishment of the Commission on Patient Safety and Quality and Assurance following the Neary scandal, which Margaret was actually on this commission. The announcement of patient safety reforms and criticism of the HSE following the Portlaoise baby death scandal. And now, following the cervical check scandal, we are seeing the heads of bills for mandatory open disclosure, a patient safety bill which was brought in a couple of weeks back, and the re-establishment of the HSE boards to oversee the operation of the HSE, which is all great, but we're still waiting for many, if not most of the recommendations from the Commission on Patient Safety and Quality Assurance going back to 2008. None of those recommendations have been implemented. For example, the licensing of hospitals. HIQA doesn't have the authority to go in and inspect private or public hospitals. They don't have that authority. That was recommended, one of the chief recommendations of that report, and it hasn't been acted upon. Still waiting for the establishment of a national patient advocacy service, which was recommended by HIQA following the Portlaoise baby death scandal in 2008. A review of international models of patient advocacy service was undertaken in 2016. And still nothing has happened, nothing. The proposed patient safety bill that Minister Harris launched a couple of weeks ago is welcomed, but in my book it doesn't go far enough. Sanctions are on healthcare providers, not on individual health practitioners. The fines are a joke, 5,000 or 3 months in prison, or 7,000 euros and 6 months in prison, and we all know where that's going to go. Nowhere. They might get the fines, but hospitals paying fines every day, 5,000 is nothing to these people, so they're not sanctions. In addition, the reporting of serious patient safety incidents in this country are to be reported to the State Claims Agency and either HIQA or the Mental Health Commission. I question the role of the State Claims Agency as the agency for reporting patient safety incidents here, because, let's not forget here, the State Claims Agency represent the interests of our state, not the interests of our patients. They are the very ones who are fighting with terminally ill women who are taking cases at the moment, no more than myself. My solicitor told me he was only yesterday in a mediation with one of his patients who was terminally ill and actually in a lot worse shape than I am, and they had her in mediation for 4 hours yesterday, and they still didn't settle or offer anything to her, and left that woman go home. So the State Claims Agency safeguards the interests of the state, and so I question their role here in the Patient Safety Bill. The HSE doesn't fund the cost of its mistakes. The costs are borne by the National Treasury Management Agency. So the HSE don't pay. There is no financial accountability either, because they're not paying for their mistakes. The State Claims Agency is. So there is no reason for them to fess up and change when they're not made accountable in any way in this country. I realise that I am raising more questions and I don't have the answers. But I am here today because I want to be an agent for change and to prevent the recurrence of any more health scandals. As a result of the mistakes and the inaction by CPL, the US laboratory, and the HSE, my cancer was not prevented from recurring at a time when I had a 90% chance of being cured. As a result of my campaigning and my actions, I want to ensure that, to quote the HSE's own vision statement, the people of Ireland can access safe, compassionate and quality care when they need it. Thank you.